Hello, folks. How are you? Welcome to Transplant Nation. My name is Sasha. On this video that I'm about to show you, I had an interview with Miss Nancy Lewis. She's a double lung transplant recipient out of Toronto, Canada. She had a transplant last July 2022. I had a really great conversation with Miss Lewis. Basically, since I'm here in the States in New York, she's from Canada. They are just slightly different procedures with regard to transplant patients, and I think you guys would really get some good information out of this. So, no further ado, please watch the first part of my conversation with Miss Nancy Lewis. And if you do like what you hear, please subscribe and enjoy. Now, well, good morning, Launch Transplant Nation. This is Sasha. This is another conversation. Today, I'm very grateful to have Miss Nancy Lewis out of Toronto, Canada. She's a lung transplant recipient, and today I'm just going to have a conversation with her about what she's been through, how she's feeling, and also that give us the different idea because I'm in New York, I'm in the States, and she's in Canada, so that could give us a little different perspective with regard to the healthcare system and so forth and so on. So, good morning, Nancy. How are you?
I'm very well, thank you.
That is awesome. Thank you for doing this. Thank you for taking the time out of your busy schedule. I really appreciate it. Like I said, this is just a conversation. There's no right or wrong answer. The idea is to inform as much as we can to people that are pre-transplant and people that are post-transplant that are just going through it. Okay. So why
Yep.
don't you tell us a little bit about yourself, Nancy?
In general or around lung
Well, yeah,
transplant?
yeah. Well, in general, basically, what got you here? What got you here, basically? What's your journey that from how you knew something was wrong until to realize that, oh, I may need a transplant.
So I had a lot of different symptoms over the years and a difficult journey to diagnosis. But in 2007, I was diagnosed with two connective tissue disorders, rheumatic conditions, scleroderma and rheumatoid arthritis. And then very quickly thereafter, I was diagnosed with interstitial lung disease and eventually pulmonary fibrosis.
Mm-hmm.
So, very often, rheumatic conditions can attack organs of the body. And in my case, they did. And mostly that was lungs. So, that was a long time ago, 2007. And I was much younger then. And very early on in that journey, my respirologist, you call them pulmonologist,
Yes.
said to me, if your fibrosis progresses, I may have to refer you to the lung transplant center. And I was like, I don't want to hear that. La 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 la. Don't tell
Yeah.
me that.
Mm-hmm.
That's the most scary thing you could ever say to me, I thought at the time.
Absolutely.
And I'm just going to pretend I never heard that. And we're going to continue on trying to treat the diseases that you can treat. And let's just not even think about that, because to me, that was just the most frightening thing I could hear. There were not, I mean, medicine and science and treatments have greatly improved for all these conditions since then. But at that time, really, mostly what they could do was prescribe steroids generally for inflammation.
Yeah.
And there were specific drugs that targeted rheumatoid arthritis, including some quite new ones that eventually, you sort of have to cast around and try them. But I found one that really worked well for me. And so I was in a lot of pain and really wasn't able to walk very well, was very thin, very frail. And eventually we found a drug that just changed my life overnight. So that was fantastic and really helped me to sort of get my life back and be more active and not be in pain the way I had been. And so things went on and some drugs came on that. So I guess first my rheumatoid arthritis after, I don't know, maybe 10 years, no, not even 10, 6 or 7 years went into remission. So I just stopped the drugs that I had been taking and continued on other drugs that had come online that would help to slow the progression of pulmonary fibrosis.
Okay.
So I took those, and eventually in 2019, my pulmonologist had been trying to get me onto supplemental oxygen, and I didn't want to. So I had this idea, which in retrospect was stupid, that going on oxygen was taking a step down a road that led to transplant that I didn't want to go on. So if I just don't start the road, I won't ever have to go towards that eventuality, which was dumb.
Yeah. No, I totally hear you because I know I went through a similar path. But let me ask you, so basically from 2007 to 2019, you kind of managed with drugs and different things with your doctors, so you were not on oxygen at that time, but you manage your diseases. Okay, which is awesome. That's a long time though, but yeah,
Yeah, it
which is
is.
okay. So
I
let's
should
speak
have
about
moved.
2019. Uh-huh.
Well, in 2018, my pulmonologist started trying to get me onto oxygen. And every time he'd suggest it, I'd make a face and refuse. And he's like, okay. And finally, in 2019, I went to see him, and I had been getting steadily worse. And he just said, that's it. You have to go on oxygen now. Like, I'm not going to let you say no. You have to do it. So, like, I was very unhappy, but I did it.
Mm-hmm.
And oxygen just helps so much. Like, I didn't realize how much it helped to get enough oxygen. Duh.
Mm-hmm.
So I went on to oxygen, and when the guy came to set me up at home, he just mentioned that my heart rate was very high as he's setting up my oxygen.
Mm-hmm.
And so my primary care doctor, when she heard that, said, go to emergency right now. You need to be checked you might have an embolism, a blood clot.
Oh, wow.
And
Okay. Okay.
that was her fear. And I'm like, I'm fine, no, but fine. She like harangued me and harangued me. And so finally I went into the emergency and I was admitted, and I had a blood clot,
Oh
a
my God.
pulmonary embolisms, a couple. So she was right and I was wrong, and this is potentially fatal, and you got to
Oh,
deal with it right away.
absolutely. You hear
Yeah.
that all the time, people dying of blood clot. I mean, listen,
Yep.
yeah, trust me. Yeah. hmm
Dumb.
hmm
So this is me slowly learning the lesson of listening to my doctors and doing what they say. That one
Yeah.
took me a while to learn. So I was overnight in the hospital, and they sent me home on blood thinners, and I still had the oxygen. And the blood thinners cleared the clot pretty quickly.
Okay.
Clots, I think there was more than one,
Wow.
but
Okay.
I didn't really get better. So I
Mm.
was just going downhill and struggling more and more I didn't ever go back to work after that. I was on oxygen, and I was just very fatigued and really out of breath and just really couldn't do much. And so eventually in August, so that all happened in February. And in August of 2019, after waiting for quite a while, I finally got into the pulmonary hypertension clinic here in Toronto. And they said, you have pulmonary hypertension.
Mm.
I had my first consult, and the doctor said, I want to admit you to the hospital right away now
Oh, wow.
from this first appointment.
Hmm.
So I'd finally learned my lessons. So I'm like, okay, how long will I be here? Like a day or two? And he said 2 weeks, probably.
Let me ask you something real quick before,
Yeah.
with regards to your oxygen level, do you remember how much oxygen you were on? How many liters were you on?
They sort of, it seems like the standard that they start us on was 2 at rest and 4
Okay. Hmm.
when exercising.
Hmm. Okay.
But I still struggled. And
Hmm.
that's what eventually, I don't know what they thought, how. Anyway, I hadn't been tested for pulmonary hypertension, but when the blood clot dissolved and I didn't get better, they're like, well, maybe we'll just wait for a few more months
Sure,
maybe
under
we'll
observations, absolutely.
maybe we'll make a referral to the pulmonary hypertension clinic, of
Mhm.
which there is only one, I believe, in the province.
Oh, really? So
Look,
not just in Toronto, just in the whole Ontario province?
I believe so, yes.
Oh, wow. Okay. Okay.
So, uh, so when they did, as I say, it was like, yes, you have pulmonary hypertension. We want you in the hospital. I was on IV diuretics,
Mm.
and 2 weeks later, I was out of the hospital. I lost 20 pounds
Oh, wow.
of water. And I'm not a big person to begin with. It was pretty
Hmm.
shocking. And although I was still severely deconditioned, I felt a lot better, just having got rid of all that fluid. So
Hmm.
then they only have one clinic because the drugs for pulmonary hypertension are very expensive, and they are covered by the province, but by funneling everybody through this one clinic, they
Mm.
know that it's the experts who are seeing you and making that. uh
Decision, how you should go about it, basically.
yeah,
Yeah, I
yeah.
mean that definitely was going to be one of my questions for you later on, but I'm glad that you kind of brought it up. Is I know in Canada all you hear is free, medicine and all that, which is awesome. But I also wanted to kind of get an idea, like how much, I don't want to say restriction, but like how much of a hand the government steers you to where you should go. And he kind of answered that for me. Because like I said, like, like for me, I'm in New York, okay, tri-state area, New York, New Jersey, Connecticut, and Pennsylvania is like, a couple hours away. And I had the option, as long as I have the insurance to cover for it, I had the options to go to any of the states, put my name on a, waiting list and so forth and so on, and go to any clinic, that I have. So basically for you, it's like, yes, we'll provide this for you, but this is the main center, right? That we want everybody to go through. Okay.
And so
Got
they're the only ones who in the province who can prescribe the pulmonary hypertension drugs, and they do the testing to figure out, what kind of pulmonary hypertension you have,
Mhm.
because some types can be treated by surgery and
Mhm.
others are treated with medications, which was me.
Mhm.
And because it is government funded and strictly regulated by this, like this, the drugs were free to me, which was fantastic
Oh
because
yeah.
they're very expensive.
Yeah. Mhm.
Um, so so they sent me home 20 pounds lighter and on a couple of drugs. And I took those drugs for a while, and I was better than I had been before, but I wasn't. Some
Yeah.
people just, it's
Yeah.
gone,
Yeah.
but that was not the case for me.
You,
So
you
they
still felt.
added,
Mhm.
sorry.
No, I was gonna say you still felt that there was a lingering, that
Oh yeah.
even though you spent a couple of months in the hospital getting treated, so once they release you, you were still on oxygen, I would assume, right? You were still on oxygen
Yes.
back home?
Yes.
Okay. All
Yes.
right. Mm-hmm.
So I was 2 weeks in the hospital. Then I went home on 2 drugs.
Mm-hmm.
And so I had pretty frequent follow ups at the clinic then.
Mm-hmm.
And then pretty soon they added another drug, and like it helped, but it didn't get rid of the pulmonary hypertension. I
Mm-hmm.
was still on oxygen. I was still struggling to exercise and just exert myself, still fatigued, just not good enough. So then in December, I think, so this all happened between August and December. My doctor said the words that I never wanted to hear.
Yeah.
I want to refer you to the lung transplant program. So it was just like, oh my God, no. So he said, just go for an assessment to see whether it's even an option for you, because of course, maybe it isn't.
Mhm.
And up until you're lying on the bed and they're going to put you under, you can say no anywhere in this journey, but just get more information and find out what your options are. So I was like, okay, oh my God. And I have to say, I've been pretty okay through this whole thing, but I cried. I got home and I cried.
Yeah.
I was so terrified. This is just the thing that I dreaded more than anything. But then I'm like, okay, we're just going to talk to them. We're just going to get an assessment and then see. So I think I got the first meeting, just an information meeting in January of 2020.
Okay.
And I spent an hour with the doctor, and he gave me tons of information about what it entailed, and blah, blah, and all this testing. And so I'm like, and he was really a great doctor, and I had a chance to ask a lot of questions. And so finally I'm like, okay, well, let's just undergo the assessment, because the end result may be you are not really a good candidate. So you never know, right? At least
Sure.
you got options if you're assessed. So again, we do have a couple of other hospitals, mostly in Toronto, I believe, that do transplants. But
Okay.
the one I was assessed at is the central one, the biggest one in Canada, has amongst the highest volumes of transplants of anywhere in the world.
Oh wow.
And
Yeah.
is,
Okay.
yeah.
I would love
And
to
is
know.
this,
I would love to know, like, to get an idea, like, how many transplants do they do? Because I know, I hear that Canada, Canada is like one of the, best places really to get a transplant. So
yeah,
30%.
this was at Toronto General Hospital, and they did the first successful lung transplant in the world.
Oh wow.
Not that long ago, shockingly. And by successful, that means, you live a week,
Mhm.
because they've done them before, but people
Sure.
die very quickly.
Yeah.
So, and they did, they pioneered also lung transplants for people with cystic fibrosis. Like, it's really a world-class center. So, like, there was no question in my mind. I'm going to do it. I'm going to do it there.
That's the place you want to be. Absolutely.
Yeah. And as you know, the more procedures you do at a center, the better the center gets at doing them.
Sure.
So I think one of the problems, maybe in the States and in other countries, is by dispersing the centers that do them, some of them don't do very many. And, I had scleroderma and pulmonary hypertension and pulmonary fibrosis. So a lot of places won't even accept people with scleroderma for transplant. But, they do them all the time here. So I had real faith and trust in this team. So I agreed to undergo the assessment, and then pretty quickly COVID hit. So, and they shut down transplants altogether for a while, because, nobody was quite sure how to manage this. And
Well, yeah, absolutely. I mean, this must have been a really traumatizing times, for especially, for transplantations. I mean,
yeah,
even if you just, I mean, the last thing you would need is to hit with a COVID virus that was just so scary in the beginning, because doctors didn't know, and the media 24/7
yeah,
are bombarding you. this is this is that, so many, I mean, you see, China literally locked down many huge cities, many region, and then Europe followed through. I mean, when what they did in Italy, I mean, they shut down Italy, Spain. So it was a time that there was a big unknown, pretty much, of what is this thing. So trust me, I can definitely empathize. Like for me, I didn't have my transplant yet, so yeah, I mean, luckily we had just came from a vacation that was planned a long time ago in February of 2020. So we escaped that. After that, everything
Yeah.
shut down, and it was a very scary moment. I mean, I remember for literally months on end, I didn't even want to get out of my house unless I had to go to a doctor's appointment.
Yep.
So,
And we actually switched all our doctor's appointments online.
mhm,
Anything we could do online, we did. So
absolutely,
you would only go into the hospital if you needed a physical test.
that's right.
Yeah. So there I was, we'll start the assessment as soon as we can. So I guess it would have been maybe June. Finally, I started getting appointments and, go for this kind of testing and that kind of testing and, all the tests you go through to get a transplant to see if you're eligible for transplant.
Mm-hmm.
And so that went on for quite a while. And I had some things I had to deal with, like dental things.
Oh yeah, the request that you did all that stuff before.
Yeah, and I had to have a couple of teeth removed, and because I hadn't been going to the dentist because of COVID.
Mm-hmm.
And eventually in October, I was deemed eligible for transplant. So I'd been through all the testing, and they said, yes, you are eligible. Do you want to be listed? So by that time, I knew a lot more than I had known at the very beginning when I was terrified.
Mm-hmm.
I was still terrified, but this is a chance to improve my quality of life a lot. And the survival rates for this particular program are very good.
Yep.
And that's partly because the testing is so rigorous, of course.
Mm-hmm.
They're not going to take you, they're not going to suggest you be listed or accept you to be listed if they don't think you're going to make it.
That's true. That's very true. That's very true.
And so, they said, yes, we think you're a good candidate. We have people here who can, manage you with your conditions. Pulmonary hypertension was the one they were most nervous about. So I agreed to be listed. So in October 2020, I was listed. And then I waited.
So
waited.
Yeah, that was my next question for you. So once you become eligible, and then you get listed in October, fast forward to when you started getting calls. I mean, how was that? What was your first time? I mean, I don't know. Were you listed on the first run? What happened in between? Did they send you home once you were listed? I mean, I'm sure
yeah.
you were home. Yeah. But
yeah.
did you ever have to come back to the hospital before transplant? Or you just got the call from home? Please take it from there for us.
So once I was listed, I was at home because my oxygen needs weren't really any different than they had been. Okay. I went up a little bit, so I do 6 on exertion and maybe 3 at rest.
Okay.
But that's not bad. I mean, you can manage that at home.
Oh, absolutely.
I was pretty independent. I was cooking. I couldn't manage like cleaning and the laundry's downstairs. I live in a little house and the laundry's in the basement, and stairs were a bit of a nightmare for me. But we had a cleaner and somebody who did the gardening. We were lucky to be able to afford that. And my focus during that time of waiting was to exercise as much as I could, which was daily. And I would worked up to like half an hour of walking on the spot. I don't have a treadmill. My house is too small, but I have a stationary bike, and I would just sort of walk on the spot and watch TV or maybe work out a bit, just some easy videos. And I tried to eat as well as I could and gain weight because I was very, very thin.
Yeah,
And
that's one thing I'm starting I wanted to emphasize this point because people need to understand that before transplant, a lot of the hard work is before transplant, meaning that, like you said, exercise, be as healthy as you can. It doesn't matter what your body type is, tall, short, skinny, fat, it doesn't matter. You have to be in the best physical, under the circumstances that you are, in the best
yeah,
physical shape and mental shape. Because
yes,
let me tell you something, that's the thing that I really got out of this because everybody goes to transplant a whole different way. But it's always good in the beginning to get yourself pumped up. Now, let's fast forward into
I'm not going
what
to
you got.
fast forward yet.
Okay, go
I'm
ahead.
still going to talk about the waiting because what I figured was, what can I control in my life? I can control my exercise. I can control my diet. I can control my attitude, if you will.
Absolutely.
And that, and then all the rest of it, like, how's it going to go? And when am I going to get the call? And, I have no control over that. So I just threw that away. I put it out of my mind. I'm not even going to think about that. It'll freak me out.
Mm-hmm.
And there's no value in it. What I can do is say, I'm optimistic about this. I hope it's going to work. I understand that it's not always successful, but I need to be optimistic and hopeful, but
Mm-hmm.
also realistic. So I used to say, like, optimistic but clear-eyed, right? I'm
Yep.
going into
Yeah.
this optimistic and hopeful, but also clear-eyed.
And that was a great attitude to have. You're right.
Yeah.
Only whatever you're able to control, that's what you can worry about. Even though as human beings, we try to go out of our purview, out of control to worry about different things. But if there's nothing you can absolutely do about it, there's no reason to stress yourself over it. And that's what's
Yep.
a great attitude to have. And in a positive mindset. Guys, please go on. You're absolutely right.
So that really got me through because I didn't get a call for 18 months.
Oh wow.
So a
Wow.
long time.
Wow.
And I would have every month, I would have a phone call with someone from the transplant program because we were still in virtual visits then. And I would talk to them and they would say, oh, it'll come in maybe 6 months. And, well, we're a little backed up right now. And, well, you have been waiting a long time.
Mm-hmm.
Yeah, no kidding. And finally, when somebody's been waiting for 18 months, they really flag it for their weekly meetings. This person's been waiting 18 months. And pretty soon after 18 months, I got my first call. So, it was a long time waiting. And in the back of your mind, you kind of think, am I really on the list? Like, this is a long time. I don't know. And will they ever call me? So finally, we got a call. And we were freaked out, my husband and I, of course, because it was the first one. And we got, we got a call, and the next day we had to show up at the hospital. And we were just like, so I came to the hospital and I was admitted and I was just lying in the bed, waiting at the hospital. And I was there for 14 hours and I couldn't eat, I couldn't drink.
Mm-hmm.
And so I was starving and thirsty. And they had me hooked up to monitors and stuff.
And all the
So
blood tests too. They
and I
did a lot of
couldn't
blood
move
tests.
around.
Mm-hmm.
Like, they just wanted me to lay in the bed. And I'm not used to this because I exercised every day. To
Sure.
just lay there for 14 hours, just getting more and more bored and impatient and thirsty and hungry.
Yeah.
And after all that, they came and said, the lungs aren't suitable for you and you can go home. So part of me is like, oh, thank God I can have something to drink and something to eat.
Yeah.
But it was a big letdown, of course.
A disappointment. Yeah.
Oh, yeah.
Yeah.
So I went home and in a way it was good because now I know what the deal is, what's going to happen when you go in there. And, now I know I really am on the list
Yeah,
because they called me.
that's right.
So within, I think, a month and a half, I got another call. That time, I think I didn't even go into the hospital. We were just getting ready to leave the house, and they called and said, "Oh, they're not suitable." And then I
Well,
had
that's at least
another,
that's good to know ahead of times without going through the process.
yeah,
Because that process was pretty hard for me. I mean, every time they do it, they collected something like 28 vial of blood, and you can't
yeah,
eat from the night before. I mean, it was just so much stress, not just mentally, but physical stress. Because for
yes.
me, I was already in the hospital, so they could just get their hands on me whenever they want. It's not like I could say
Oh,
anything. I was already hospitalized, and I had 6 dry runs. So imagine
6 is a lot.
every time they took all these blood vials, and then sometimes they make a mistake. The couple of times they made a mistake with labeling the vials. So it's like, so we gotta poke you again. I'm like, are you kidding me? I remember like one night I had to give almost to 55 blood because the first
Oh,
batch they had to discard it because the nurse that came in wasn't sure, mislabeled them because they each have their own specific thing that they have to go through, and
yeah.
he mislabeled them, and then they had to draw blood again. I was like, I was beyond furious because I was just exhausted, mentally and physically. I was exhausted, and then to find out that was another drive.
And also for me, I'm a very hard stick. Like
Mm,
it's
me too.
really
So
hard
they
to
tell me I
get.
got moving veins or something.
Yeah, I don't know. Well, scleroderma tightens the skin and the tissues,
Hmm.
so it makes it very hard to do a big needle, and they just slip away, and it was just awful. So every time I was admitted, they'd have to do it again, and it's painful, and sometimes they have to do it 2 or 3 times, and ugh. So then the next time I was called, so this is number 3, I got all the way into the emergency department, and they called at the front desk. It was a nighttime admission, so you have to go through emergency. And I was just coming through. My husband dropped me off, and I was coming through, and I sat down at the emergency admission, and they called, "No, not suitable." So back home again. At least I didn't get poked that time.
Hmm.
Uh, and so so it went on, and finally at 20 months, so in July, uh, I got a call, and they said, "Come in tonight. Don't eat or drink anything all day." So I did. And the next morning at 6:30, the nurses came rushing in and said, "We never seen this happen before, but they want you now. You're early to go into the operating room." So I'd never made it into the operating room. So it was like, oh my God. And I called my husband, and I got wheeled into the operating room and had my transplant.
Okay, let's pause it right there. That's a good thing. Let's